I'm not sure that there was a pivotal moment that I wanted to become a leader in the workplace. In fact, I don't think that I ever really had the aspiration of becoming a leader, but as I was asked to take on more responsibility and to effectively lead bigger and bigger projects, I found that it really tapped into, I think, a clarity about things that I wanted to see have happen, and the realization that in a leadership role I could actually affect some of the change that I wanted to. And so over time, I found leadership more and more satisfying. The biggest risks that I've taken in my career probably was taking the job that I have now, which is as the CEO of the University of Utah Healthcare, as well as the Dean of the Medical School and a Senior Vice President role for the Health Sciences. Because this was really a significantly bigger responsibility than I'd ever had before. When we lived in New York, I was responsible for the research part of the portfolio, and now all of a sudden I was not only responsible for research, but also the clinical, faculty, education, as well as a large healthcare system and health plan. So it was a much bigger responsibility. But like all somewhat carefully thought through risks, I think it has really proved to be the best thing I've ever done. Well, for me, taking on the role that I have now, it was a significantly greater responsibility than what I had before. And I think that objectively, I think most people would have said that I wasn't particularly well qualified for it. That said, that during the interview process, I was asked a lot of questions about what I would do in this new role. And having been a part of the team that had done similar work, I had observed a lot. I had some ideas about what I thought worked and didn't work and where I would take an organization, and I guess those were persuasive enough to the folks who were doing the choosing to be convinced that I was the right person for the role. And I think because I had some of those ideas, I came into the job. There was always a part of me thinking imposter syndrome, what are you really doing in this job? But there was enough saying, well, actually, I kind of have an idea about what to do here, that could get me going. The most challenging part of what we're working on right now is that we're really trying to fix healthcare. I mean, that's really what I view my mandate at the University of Utah is, and that's the reason why I'm in the job that I am. So that's a pretty enormous challenge. And what we're trying to show is that if we can follow a few principles, if we can really engage our physicians and our providers, they will really help us engage patients. And if we can do that and really work together, use a lot of data, use a lot of feedback, take advantage of the fact that patients want to improve and do better and look after their health, physicians certainly want to improve, be better doctors or care providers, that we can really get ourselves onto the virtuous cycle of better quality, better outcomes, better patient experience, and all of those are going to drive down costs. That's the biggest challenge that we're facing. My advice for somebody relatively young in their career is to really live in the moment and to try to get as much out of whatever environment they're in, to learn and grow as much as possible, rather than thinking too much about the next step or the step after that. I think sometimes when you're looking too far ahead in the future, you miss all the opportunities that are right in front of you. And they may seem like responsibilities or tasks that are trivial or not necessarily going to help you get to some other stuff, but I find that the people who are the most capable, the people that I want to hire, are those who have, whatever the environment is, whatever the situation is, have seen with the opportunity, have applied their own creativity and innovation or whatever it is, or teamwork, whatever their skills are, and made it just that much better. And I think if you have a series of life experiences like that, even if it's in McDonald's, figuring out how to make the process just a little bit better, it's going to enrich you and set you up for success regardless of what it is.